Today, staff at Sentara took time to talk with us, even after working long shifts and working to save lives.
Now, they say hospitals are close to capacity, wait times have become longer and longer, and the victims of COVID become younger by the day. 10 on your side's Chris Horne has more on this stress to the system. Chris?
Anita, it's the second worst surge since the pandemic began. Providers are scrambling to find enough beds in ICUs, and at Norfolk General, which is a level 1 trauma center, they're used to seeing very sick patients, just not this sick. And they say adverse reactions are exceedingly rare, so they can't understand why people are reluctant.
At least 90% of these people are not vaccinated. And so what that tells me is that the vaccine works.
Providers say the Delta surge is much worse than the original strain of the coronavirus for younger patients. And many of those patients thought they were too young to get infected.
The more striking thing for me is just how young they are. They're 40 years old, they're 30 years old.
They're very short of breath and they're very scared. A lot of them say that they wish that they had gotten the vaccine.
The hospital system in Virginia is getting bombarded on all sides. The COVID surge, plus providing care for Afghan refugees who've resettled here. And then there are the Virginians who are only now getting medical care that they delayed during the pandemic for fear of visiting a hospital and getting infected.
We're seeing some of that pent-up demand start to manifest itself by an increase in people seeking out health care. So that's occurring now.
If you're on the fence, don't wait until you get it to decide you want to get the vaccine.
Sentara says they are not turning people away from care, but expect wait times to be longer, especially if you go into the emergency room. Chris Horne, 10 on your side.
Thank you, Chris. And